has been used already to monitor over 3.5 million pregnant women in the hospital. But with our new product, Sense for Baby, we can now monitor these women at home leveraging Apple Watch.
Apple letting more developers work towards healthcare solutions, in this case by using apps to monitor patients' vital signs, even unborn babies. Fox News Medical A-Team, Dr. Marc Siegel, and emergency room nurse practitioner Erin Tolbert with me now. So, Dr. Marc, first of all, what do you think of this kind of functionality from Apple?
I think it has tremendous promise, Deirdre. The question is going to be, is the information going to get to the doctor or nurse, or is it going to stay with the patient? The idea of monitoring a baby's heartbeat, a fetal heartbeat, remotely without the woman in the hospital is a tremendous idea, because that's what obstetricians are going to want. Same thing with heart rate, same thing with blood pressure, same thing with an EKG if you suddenly are having chest pain. This is the wave of the future. Also, they can put together this information and actually do studies this way, which is what Research Kit does that the Apple Watch has. This is a great advance. The question is, will it get to the right hands?
Will it get to the right hands? And Erin, this is where I want to bring you in. Is a little bit of information more dangerous than a lot? That is to say, what do you think about these capabilities? Is it going to flood ERs with people with all kinds of extra questions?
I don't think it's going to flood emergency departments. I think it really actually does the opposite. It puts patients in control of their own health information. So with a little bit of medical guidance, for example, they can monitor things like their heart rate. So if I put somebody on a medication that may have a side effect that increases heart rate, they can easily check this on their own rather than just ignoring it completely or having the need for a follow-up office visit. And so I think it really puts this information in the hands of people so that they can monitor their own health, be responsible for their own health habits. I don't think people are going to be flooding to the emergency department for a pulse rate of 102 when their doctor told them, for example, follow up if it's more than 100. I think it's a positive.
I want to move on. Dr. Siegel, I'll start with you. A new study finding that Alzheimer's could be spread. It's a possibility, person to person. This seems against what we've all understood about that disease.
Wow, this is a big headline, and people are likely to misinterpret it and get very afraid here. But this is about the idea that people that got CJD, which is an infectious disease that was gotten through growth hormone back earlier than the 1980s, and they followed them later on. We're only talking 8 people here. They found that they had the proteins that you see in Alzheimer's disease. That doesn't mean that if your neighbor has Alzheimer's, you're going to get it, or if your grandmother has it, you're going to get it. None of that. What it means is that the proteins that are associated with Alzheimer's are sticky and can, Deirdre, stick to surgical instruments. So it's possible that there's a very remote chance that down the line somebody could end up with this that you weren't expecting to end up with it. That's the advance here. That's the information. But again, this is not going to be a big epidemic.
8 people.
8 people. Very, very small. It's not going to change the way we understand Alzheimer's. Most of the time, it is not an infectious disease, not something you can catch.
Okay. And Erin, obviously, you're in these hospitals, that you're working as a nurse. No one, I am assuming to date, has said, I'm worried, I don't want to work with this Alzheimer patient because I'm going to catch it.
Right, no, and just to echo Dr. Siegel's sentiments, this is not typical human-to-human transmission. This is things like tissue donation, for example. And this study is based on a series of medical events that happened related to human growth hormone, which is extracted from human cadavers. So it really gives us more information about things like tissue donation, medications that are derived from human or animal products. It's not so much a concern for your average everyday American as it is for the medical community, and how do we sterilize instruments, how do we create medications.
Thank you both so much. Glad to have you with us. Dr. Marc Siegel, Fox News A-Team, and Erin Tolbert. She is an emergency room nurse practitioner, both joining us there.